Welcome to Washington Unplugged. I'm John Dickerson. The president says former Senate Majority Leader Bill Frist, a Republican, supports his health care plan. Is that true? We'll ask the former lawmaker and heart transplant surgeon who has written a new book, A Heart to Serve. Welcome, Senator.
Good, John.
I want to ask you about health care reform. Would you support the president's plan?
We don't know what the president's plan is. There are 5 bills out there. The Senate plan the other day that passed out of committee is 1,000 pages, $1 trillion. It's going to be married to about a $1.4 trillion plan in the Senate and a $1.6 trillion plan in the House. So we don't know yet. What I am for, and it's for reform, and I think we need to aggressively look at both the access issue, and the bill does well, all these bills do well with the access, bringing about 30 million people into the insurance markets, and that has to be done. If you're uninsured, you die sooner in this country. My questions today, and the real challenge, is the cost issue. The $2.3 trillion, 18% of our economy, all those are big numbers, but really how does it affect you as an individual? And unfortunately, the bills that are going through Congress now don't address the fact that premiums have been increasing 3 times faster than inflation over the last 10 years, every year, and that simply can't be sustained. The bills don't even pretend to do that. In fact, they do raise premiums, which we all know now, and they raise taxes. We need reform access. In this book, A Heart to Serve, let me jump right in, is I do basically say the best way to bend that cost curve over time so that your benefits you can either keep or get new benefits, slow down this cost inflation, is through a much more consumer-based, provider-friendly type, patient-centered system that involves more markets than what the president's doing.
But that kind of distinction is very different than what the president's doing. It's very different than what's going through in Congress at the moment.
It is. And first, I'm a creature of the Senate, and therefore I really do support the process. The process, and I talk about it in A Heart to Serve, that we used in 2003 for the Medicare prescription drug bill, a very expensive bill, but a very good bill, was bipartisan. We had 76 votes coming out of the United States Senate for a bill that was probably over 10 years an $800 billion bill. It's a big bill, but we had bipartisan support, and so far all we've seen is real partisanship.
Do you think there's any chance, though, because even what you're suggesting, the way Democrats see it, is far away from where they are now, in terms of when you told Karen Tumulty that leadership, you said you'd vote for it, Karen Tumulty of Time magazine, you'd vote for it, that's what leadership's about. Tell me how we bridge the gap between what you and other Republicans think and where the Democrats are now. Is that gap bridgeable?
It is. Well, I think it is. Again, because I have faith in the system. It's going to take involvement of the American people. It is hard when there are some simple things that don't cost anything, like frivolous lawsuits could save $50 billion a year. But the big thing, it would protect the doctor-patient relationship, which is being destroyed, or association health plans, allowing groups to get together to purchase plans. It is crazy to me just to exclude ideas like that, which we know will lower the cost of health care over time. We absolutely know it, because they're not the idea of a certain party. Yes, there's time. The American people can speak up and say, we're not going to accept a partisan bill. We're not going to accept a bill that is written by a group of people that excludes either centrist Democrats or Republicans. Now, the flip side of that, the Republicans are saying no, the Democrats they're saying no. Well, let's put some common sense things in there that we know will bend the cost curve, because if we don't, there's going to be a huge rebellion a year or 2 years or 3 years from now.
Well, now, they did get one Republican, Olympia Snowe, who voted for the Senate Finance Committee bill. The White House says that's a sign of bipartisanship. Is that real bipartisanship?
Well, no, and I think American people know that that's not. Olympia, I have huge respect for, and she has real questions. We've got 5 bills, so we've got time to do this. I mean, people say put it off till after January. I am for reform. I think if we work the process, if we listen to the American people, we accept amendments. We have 5 bills that actually are pretty different in lots of ways, include new ideas. It can be done. If it's not done, I think it's going to be to the detriment of the American people.
Last question on health care reform. As it stands now, these 5 bills are moving forward. You say it's been a partisan process. Would you counsel or advise your Republican colleagues to vote no against this as it's going forward?
No, well, not yet. I think in committee I would have voted no against the Baucus bill now, because I think it doesn't do enough to slow down the growth of cost. It basically costs you more, it costs every American more, and nobody's getting anything more for it now, but in the future it gets worse. That can be made better. I would continue to support the process. I would pull people together. Right now, an important discussions going on between the two bills in the United States Senate, how they get married together. One is 1,000 pages, the other is 800 pages, so we'll see how that happens, but let's look at it. We do need to get full scoring for this bill, and that's going to take probably 2.5 weeks.
Congressional Budget Office.
By the Congressional Budget Office to know what we're getting into over the next 10 years, and I would say the next 15 years, because what we're doing, we don't want to go down this road of a major experiment with the American people, and that's going to take about 2.5 to probably 3 weeks to fully score these bills as they get married together.
All right, let's pivot to your book here now. What's it about?
Well, the book, I appreciate you asking it, because it's a heart to serve, the passion to bring health, hope, and healing. It is not a political memoir. It's not sort of going through day by day what I did in the United States Senate, but it's much more of a review of why somebody would serve. 20 years in medicine, healing one-on-one, 12 years in the United States Senate looking at the health of the nation and the health of a state, and 10 years in the global health arena. And it does recount stories like the times of me going to the Sudan, doing surgery, in Mozambique doing surgery, the volunteer work I have done. It has my biggest disappointments, my biggest challenges, some of the successes that are in there. But really what I want people to do, and it's captured in the subtitle, The Passion to Bring Health, Hope, and Healing, I want you and everybody listening today to go deep in their own lives, deep in their own hearts, deep in their own spirits, and drawing up on the experiences they've had, capture their own passions, and whatever those passions are, shape them actively in a way that they go out into their communities or working with their family or in their cities and serve in a way that lifts people up. And the stories in here, some of which are sort of inside baseball, some of which are very personal, hopefully will inspire people to capture their own passions so that they can serve mankind in ways that I've tried to do, like medicine, healing, global health. For somebody who may not get what the point you're making immediately, what if they said, why? And that's what the book is about. The why. I would lose my mind to go stop doing heart transplants, saving people's lives, and come to this town, Washington, D.C. Why? What is the why? And the why is, well, in that one, I ended up participating in a bill like the prescription drug bill that allows 40 million seniors today that they didn't have before to have affordable access to life-saving drugs or HIV/AIDS. By playing a little role of losing my mind, going down a path not taken by many doctors. When I came, a doctor hadn't come to the United States Senate in 68 years, yet it's a big part of our economy today. HIV/AIDS right now, after 25, 30 million people dying, right now probably 10 million people fewer will die because of our sausage-making factory of government here and generosity of the American people through legislation called PEPFAR. So crazy decisions that may seem crazy to people leaving the practice of medicine, coming to Washington, almost serendipitously can come back and improve humanity broadly. And then the little stories in here of working in soup kitchens, of participating in community projects, the gratification of lifting people up emboldens, encourages, and inspires each of us as individuals. Final question about serendipity. David Petraeus, who we've all come to know, who's the commander of the Central Command, you had a situation with him. Would you explain that briefly? Well, I will, and I put that, and there are a lot of stories, mainly about other people in the book. And in 1991, late September 21st, I was watching a soccer game with my son. My beeper went off. At that time, I'd never thought about politics outside of it. I was a surgeon, a doctor. Come to the hospital. I went over to the hospital. I said, be there in 10 to 12 minutes. I said, why? They said, somebody's been shot with an M16 through the chest with a hole blown out the back, took off the top of the lung, and they're bleeding, and you need to come in and operate. I went in, and I found a young soldier there who just got off the Life Flight helicopter, took him to surgery, did a 14-inch incision around the chest, put my hand in the lung, stopped it. And also that's the drama, and that's your capture. But the point of it is that young soldier had been in an accidental live fire exercise, shot by another soldier from about 30 meters. And 12 years later, it was the same David Petraeus, then a battalion commander, who led the assault on Baghdad and ultimately designed the surge. Never having thought of politics before that time, 1991, 3 years later went to the United States Senate and then became majority leader, and 12 years later we were in Iraq seeing each other once again. Carrying out just normal activities of what you do through service has these serendipitous full circle stories, and that's one of them that's in here, one of the more dramatic ones. All right, that's great, Senator. Thanks very much. New book, A Heart to Serve. Thank you, John.